Let's talk about the Zika virus. Most Americans hadn't even heard of it 2 weeks ago.
The good news is this is not like Ebola. People don't die of Zika. A lot of people get it, don't even know that they have it. What we now know, though, is that there appears to be some significant risk for pregnant women or women who are thinking about getting pregnant.
And when you look at the pictures of the babies, it's very disturbing.
Yeah, and we don't know exactly what the relations there are, but there's enough correlation that we have to take this very seriously. And so we're going to be putting up a legislative proposal to Congress to resource both the research on vaccines and diagnostics, but also helping in terms of the public health systems. But there shouldn't be panic on this. This is not something where people are going to die from it. It is something that we have to take seriously.
As many of you may have seen, prior to the big game last night, the president had a conversation with Gayle King from CBS, and he noted that the administration would be putting forward today a legislative proposal to Congress to fortify our efforts to combat the Zika virus, both overseas and here at home, and making sure we're taking the necessary steps to protect the American people. So given the frequency with which we have discussed this issue over the last couple of weeks, joining me today at the podium are two of the U.S. government's foremost experts on this issue, and they can describe to you both some of the risks associated with this public health issue, but also describe to you the steps the U.S. government is taking to protect the American people. So to my immediate right is Dr. Ann Schuchat from the Centers for Disease Control, and to her right is Dr. Tony Fauci from the National Institutes of Health. Both of them will make brief opening comments, and then they'll stick around for 15 minutes or so to take any questions that you have. Questions on other topics I'll handle after they depart. Okay? So Dr. Schuchat, you want to go first? Sure. Thank you.
Hello, everybody. As you know, last May, Brazil reported the detection of the Zika virus. This was the first recognition of this virus in the Americas, even though we've known about the virus for more than since 1947. The virus causes a mild illness in most people. In fact, 4 out of 5 people have no symptoms at all. But last fall, Brazil noticed an increase in an unusual birth defect called microcephaly, and we began to be concerned that this virus could potentially be associated with serious complications of pregnancy. Since that time, the virus has spread to a number of countries in the Americas. It's also spread to U.S. territories, including Puerto Rico, the U.S. Virgin Islands, and American Samoa. And we have had cases in travelers here in the United States. CDC, the Health and Human Services, and the entire U.S. government is taking this very seriously. For the average American, this is not something that will change your day-to-day life, but if you are pregnant, we have taken the unusual step of recommending that you avoid travel to areas where Zika is spreading. Or if you live in an area such as that or must travel, that you be very vigilant with applying mosquito repellent and taking steps to avoid mosquito bites. We are working 24/7 to understand this virus, to detect it where it is occurring, and to prevent its spread. This will not be easy because the mosquito that spreads Zika virus is aggressive daytime biter. It lives outside and inside the home, and it can be pretty hard to control it. You know in the backyard how hard it can be to control mosquitoes. Well, this is one of those mosquitoes that's quite difficult to control. That said, we're working very aggressively with areas where the virus is spreading and areas where it may spread to make sure that they're prepared and that we can help prevent serious complications of pregnancy. At the same time, while we learn more about the risk in pregnancy and the best ways to reduce that risk. We're working on, with all of the states and local areas on surveillance, reporting. We've made this disease nationally notifiable. We've shipped out laboratory diagnostic tests so that states can recognize this. And we've issued a number of guidances, not just for travel, but guidances for healthcare workers so they know how to take care of women who may have been exposed to the virus and how to counsel them about things like sex during pregnancy. So I think that we are working very hard to get the information that Americans want and to work with our partners around the world to understand this virus, but also to control its spread and mitigate the harm that it may do.
The White House is asking for $1.8 billion of funds to focus on this. Can you, Mr. Ernest, give us an idea of when this could be approved?
Well, obviously, obviously, the request that we have put forward is a request that we've made of Congress for the kinds of resources that would be beneficial in advancing the efforts that Dr. Schuchat and Dr. Fauci have been talking about here. There was a reference to the limited supply of some diagnostics to confirm whether or not you've had the disease. That's something that we could use additional resources to increase that supply. There's been discussion about the development of a vaccine. We would like to apply additional resources to that effort to see if we can speed that up or at least make the likelihood of success in those tests greater. So there are a number of ways in which these resources can be used, and we are hopeful that Congress will recognize the urgency of this request and act quickly on it.
If the $1.8 billion of emergency funds is delayed, diminished, or denied in any way by Congress, how does that affect the outlook of what you're looking at in terms of the response?
Well, obviously, in order to do the full gamut of what we need, we're going to need more resources. So if we don't get the resources, we're not going to be able to do as much as we would have. If it turns out that it's delayed or what have you, then at least in my institution, I would have to move money away from other things to do this, because this is something that needs to be addressed right now. But we're hoping for the best, and I think from what I'm hearing, the reaction of the American public to this, I would hope that we would have a smooth sailing with getting this through.
And I just want to say we are working 24/7 to protect Americans right now against the threat of Zika and to support the areas that have already seen spread. We expect with the warmer months to come that more risk will be present. And so this is really a time where we need to scale. We need to scale up the diagnostics that are getting shipped out, and we need to be working on better diagnostics so that problem that a pregnant woman has about, well, you might have this, but we're not exactly sure. You know, time is really precious for this kind of emerging infection.
Chairman of the Appropriations Committee, Hal Rogers, wrote a letter to the White House saying, basically turning down your requests for emergency funding, saying that Congress should use funding for Ebola to fight and redirect that toward fighting Zika. I know this is an approach that you've rejected in the past, but given opposition coming from Republicans now, are you willing to reconsider that at all?
Yeah. Well, Jordan, I think I would start out by saying that the important work that the United States has done to fight Ebola and to protect the American people from Ebola is not done. I recognize that that disease has receded from the headlines. I think we're all pleased about that. But the important work that needs to be done to build up the public health infrastructure of countries overseas to make sure that those outbreaks don't quickly spiral out of control. We've seen firsthand, as recently as a little over a year ago, how that can have direct consequences on the safety and well-being of the American people, even if that outbreak occurs an ocean away. So it's critically important that we follow through on those efforts. And it would be profoundly unwise to take money away from the ongoing effort that's needed to fight Ebola. Now, is there some funding that could be taken away from, that could be repurposed without undermining our efforts to fight Ebola? Yeah, there probably is. In fact, that's likely to be part of our request. But those funds, those resources, would not be sufficient to take on what we believe is a pretty serious threat from the Zika virus. We want to make sure that we're prepared, and we're hopeful that when we put forward a proposal, a specific proposal that's coming soon, that the Senate and the House will be prepared to act on it quickly.
We all have to remain vigilant when it comes to the spread of disease. Since late last year, my administration has been focused on the threat of Zika. So far, while there's no evidence of Zika transmission from mosquitoes here in the continental United States, there are confirmed cases in Puerto Rico. And as leaders, it's important that we convey very basic facts, including the fact that Zika is not like Ebola. Ebola was primarily spread from human to human. Based on what we know right now, Zika spreads predominantly through the bite of a certain kind of mosquito that's limited to certain parts of the country. Symptoms are generally very mild. Most folks don't even realize that they have it, but as all of you have read, the possible connection between Zika, birth defects, and other serious health problems means that we've got to take precautions, particularly with respect to women who are pregnant or are trying to get pregnant. So we're going to be fighting this disease at every level with every tool at our disposal. I've called on Congress to approve about $1.9 billion in emergency funding for our efforts at home and abroad, including research into better diagnostic tools, new vaccines, improved methods of mosquito control, and support for Puerto Rico and territories where there are confirmed cases. And we're going to be launching an aggressive coordinated campaign with the NGA to stop Zika at the source and keep Americans healthy. I hope each of you join us, especially if you're in some of the southern states where the risk of transmission may be higher.
On Zika, the White House is planning to hold a summit on Zika in April to try to control the spread of the mosquitoes that would spread the disease. Can you talk a bit about why the White House has chosen to move ahead with the summit at this time, the main goals that you hope to accomplish out of that, and kind of the outlook for Zika response at this point?
Mm-hmm. This summit is actually the result of a discussion at the National Governors Association conference here at the White House a couple of weeks ago. The CDC will be hosting this conference in Atlanta on April 1st, and it will include representatives from state and local governments across the country, including many governors. And it is an opportunity for us to bring together these leaders from across the country with the foremost public health experts in the U.S. government to discuss what prudent steps should be taken to protect the American people. The administration has treated this as a top priority, and we certainly recognize that when confronted with risks like this, early action is important.
To introduce Dr. Tom Frieden, CDC's director.
Welcome to Atlanta. Welcome to CDC. Thank you all so much for being here. This is a really important day, and welcome not only to those of you in the room, but to the more than 1,500 of you watching on webcast. I want to give a special thanks to the White House for their leadership and support, to the Department of Health and Human Services, and to our many U.S. government partners. You've seen a list of them. This really has been a whole-of-government and a whole-of-society response. I also want to thank the state, tribal, local, and territorial health departments, many of whom are really on the front lines of this struggle against Zika, and with whom we have a tremendous partnership. Zika is already in the U.S. and territories. It's already affecting hundreds of Americans who've traveled to Zika-affected places. It's already spreading widely in Puerto Rico and elsewhere in the U.S. territories. We expect it to continue to spread. Mosquito season is upon us. We cannot predict what the exact future of Zika will be. We do not have a crystal ball, but we can tell you what science suggests it may do based on other similarly spread vector-borne diseases. And that could include thousands of travel-associated cases in the U.S., hundreds of thousands of cases in Puerto Rico, and now we're learning some sexually transmitted cases as well, anywhere where Zika is spreading, and possibly clusters of Zika in areas of the U.S. which have competent vectors, particularly Florida, Texas, Hawaii, and potentially elsewhere. We're here together for an important reason. We must work at all levels of government and all through society to reduce the risk of pregnant women, to effectively combat the Zika threat. At the same time, we need to think of the bigger picture. President Obama, in our first briefing on this, urged us to think systematically and not just episodically about mosquito-borne and other crucial threats facing this country and the world. We need to ensure that we come out of this not just with reduced impact of Zika, but also with sustainable mosquito control infrastructure, with improved surveillance, with improved partnerships within the government and between government and civil society.
The real challenge, then, is whether our nation is going to do what's necessary to help pregnant women stay healthy. Today, representatives of state and local governments are gathering to refine their Zika plans and learn from each other. They are already committed to doing everything they can, but they cannot do it alone. Congress must also do its part. The March of Dimes and our partners are calling on Congress to pass emergency spending legislation to give CDC, other federal agencies, and states the resources they need to combat Zika virus. We're grateful for their commitment and the extraordinary work of the staff and scientists here at CDC, in other agencies, and in the states. But they should not have to fight Zika by raiding funds from other important public health priorities. Shifting money from crisis to crisis will have us chasing our tails instead of organizing a holistic, comprehensive response to these public health challenges. We don't have the luxury of time. We have a few short months to stop Zika virus from gaining a foothold in the U.S. If we don't, the consequences will be dire for affected infants. Congress must act immediately to provide the resources for us to hold back the Zika virus and to keep our families and babies safe. Thank you.
For months now, the administration has been warning about the risk posed by the Zika virus, particularly the risk that is posed to pregnant women. In early January, in the midst of a significant snowstorm that many of you may recall, the president convened his top advisors to formulate a proactive response to this epidemic, which has spread across the Americas. In February, the administration formally submitted a request to Congress for $1.9 billion for activities that scientists and experts say are critically important to combating Zika. This includes funding for mosquito control, which is particularly important now that the weather is beginning to warm up. It also includes funding for things, well, not today, at least not today in Washington. But the funding also included investments in disease detection and testing, vaccine development, and support for maternal women's health. Just last week, the administration convened a summit in Atlanta of top state and local health officials, nonprofit officials, and healthcare experts. We heard from states that they're keenly aware of the threat that the disease poses, and many do not have the money that they need for basic tasks that would prevent the spread of Zika. Over this time, Congress has done nothing. Now, we know that we cannot continue to fund a robust response to this disease without adequate resources, particularly for our partners in state and local government who bear much of the burden of fighting Zika. So earlier today, as many of you may have seen, the administration announced that we would reprogram about $600 million to bolster the ongoing Zika response. We've consistently said that an available option was for the government was to repurpose some existing Ebola funds that would not undermine our fight against that deadly disease. But we also told Congress that just using some of the Ebola funds would be insufficient. I think that should be an indication to you that today's actions to reprogram $600 million is a temporary fix and not at all a long-term solution. Since the beginning of the year, our concerns about Zika have only increased because of some new things that we've learned about the disease. First, we've learned that sexual transmission of the virus is actually more common than was initially believed. Second, we learned that the impact of the virus on fetal brain development is likely starker and more serious than first understood. Third, in the United States, the geographical range of the mosquito that carries this virus is significantly broader than our initial estimate. And as we learn more about all of these things, we continue to be concerned about the potential impact of this virus on the public health situation inside the United States. So let me leave you with a couple last thoughts. The first is that this is actually a pretty unique scenario. We've got advance warning of a disease. It was difficult to predict in advance that Ebola would wind up in a patient that had presented himself at an American hospital. That was something that few people predicted. Everybody now is predicting months in advance that we're going to see more cases of Zika in the United States. That means that we have an opportunity to do something about it in advance. As I stood at this podium and talked to you about the risks that were posed by Ebola, I think many of you legitimately observed, why hasn't the government done more to prepare for these kinds of situations? We do have an opportunity to prepare for the Zika virus, but Congress has completely abdicated their responsibility to follow through on a proposal that the administration put forward based on the advice of scientific experts. So the administration is going to do what we can right now to fight this disease by shifting funds temporarily from the fight against Ebola into the fight against Zika. State and local officials are certainly doing their job right now to try to prepare their communities to fight Zika. Now it's time for Congress to do its job for a change. Mark my words, at some point, and I don't know when it's going to be, at some point later this spring, maybe later this summer, all of you and your news organizations are going to be sounding the alarm about the significant threat that is posed by the Zika virus. That is going to happen. We know that as the weather warms up, as the mosquito population spreads, that this is something that we're going to have to deal with.
Since we last discussed the Zika virus, we continue to be learning pretty much every day, and most of what we're learning is not reassuring. We have learned that the virus is linked to a broader set of complications in pregnancy, not just the microcephaly, but also prematurity, blind eye problems, and some other conditions. We have learned that the mosquito vector, the Aedes aegypti mosquito, is present in a broader range of states in the continental U.S. So instead of about 12 states where the mosquito Aedes aegypti is present, we believe about 30 states have the mosquito present. We've also learned that the virus is likely to be a problem at much of the pregnancy period, not just probably the first trimester, but potentially throughout the pregnancy. This information is, of course, of concern, and CDC's been working 24/7 to protect pregnant women, to support the state and local health departments that are that front line of defense, to learn as much as we can about the mosquito that can spread the virus and about the virus itself, and to work with other countries to learn what we may be seeing later in the continental U.S. We are quite concerned about Puerto Rico, where the virus is spreading throughout the island. We think there could be hundreds of thousands of cases of Zika virus in Puerto Rico and perhaps hundreds of affected babies. We know that the pregnant women in Puerto Rico are very keen to protect themselves and to have community protection, and we're working closely with the authorities in Puerto Rico to support that response with mosquito control beginning and with the distribution of what we call Zika prevention kits for pregnant women. We've learned that mosquito transmission is the usual way that the virus can spread, but it also appears to be spread through sexual transmission, and that has meant we've had to issue updated guidance for couples on how to prevent spread of the virus, particularly to pregnant women. The other thing that we've learned is that there's a resounding interest in preventing this disease and controlling it as well as we can. Last week, on April 1st, the CDC and U.S. government convened a Zika Action Plan Summit in Atlanta. Leaders from more than 30 states and territories joined in Atlanta to do Zika action planning to get ready for mosquito season. There's a lot to do to increase laboratory diagnostic testing, to increase mosquito surveillance, to increase human surveillance and birth defect surveillance, and to improve our communication so people have the best information to protect themselves and their families?
The answer is I don't have what I need right now. What I've done is take money from other areas of non-Zika research to start. We couldn't just stop and wait for the money. We had to go ahead for it. The only trouble is if we don't get the money that the president has asked for, we're not going to be able to take it to the point where we've actually accomplished what we need to do. So the answer is we really don't have what we need, but we're still going full blast by drawing money from other areas. And that's how we started. The money that's being transferred over from Ebola account will help bring us a little bit further, but it's still not what we want. When the president asked for $1.9 billion, we needed $1.9 billion. I can't imagine, as we learn more and more things that are troublesome, that all of a sudden we're not going to get the money. We really do have to get it.
That there are some quite simple things that Congress has struggled to do. I think the example that's at the front of my mind today is the administration 2 months ago put forward a specific documented request for $1.9 billion in funding to fight Zika. This is a virus that we know threatens pregnant women and their newborn children. This is a virus that our scientists and public health professionals are increasingly worried about, but yet we haven't seen Congress do anything on a common sense matter of public health and public safety. That's quite a disappointment, and I think it reflects the level of dysfunction in Congress right now, particularly because we see too many Republicans dragging their feet to act on what should be a rather common sense piece of legislation. That does diminish my expectations when it comes to assessing Congress's ability to tackle something as complicated as an encryption policy.
Yesterday, the House passed a Senate bill that's supposed to speed up vaccines and treatments for diseases, including Zika. And I wondered if you might be willing, or give you an opportunity to walk back a little bit of the criticism of Congress on that issue, since they have passed this bill and it's now coming to the president's desk.
Well, Darlene, I hate to disappoint members of Congress, but the passage of that bill that you described is positive, but a rather meager accomplishment. We were talking about it earlier. In some ways, it's akin to passing out umbrellas in the advance of a potential hurricane. So an umbrella might come in handy, but it's going to be insufficient to ensure that communities all across the country are protected from a potentially significant impact. That's what we're focused on. Darlene, you may be familiar with the expression of being a day late and a dollar short. In this case, Congress is 2 months late and $1.9 billion short in providing the assistance that our public health professionals say that they need to make sure that they respond appropriately to this situation. The bill that Congress passed yesterday doesn't include any funding.
It was a case of accumulating evidence rather than a single smoking gun. But the scientific verdict is in, and the Zika virus has been found guilty, making it the first mosquito-borne virus to be linked to birth defects. It began in northeastern Brazil last fall, when doctors first noticed an increase in the number of babies born with unusually small heads, at the same time as the Zika virus was spreading in the region. The virus was the immediate suspect, but there was not enough proof to make a causal link. Over the next months, the case became stronger when the virus was discovered in the fetal tissue of affected infants. And more evidence appeared as Zika spread to Panama and Colombia, infecting pregnant women. Already, about a dozen more cases of microcephaly and fetal malformations have appeared. Added to that, the microscopic studies revealing how the virus infects human brain cells.
Epidemiologic data, clinical data, and basic science data have all pointed in the direction that indeed Zika virus does cause neurologic complications.
After weighing all the evidence against an established standard of proof, scientists have concluded a causal relationship exists between prenatal Zika virus infection and microcephaly and other serious brain anomalies. There are other scientific questions that still need to be answered. What is the range of birth defects that Zika can cause? At what point in the pregnancy? And is the risk of complications high or low? and there are also questions about the range of disease in adults. Although the infection is mild in most people, scientists now believe Zika can cause a rare neurological complication called Guillain-Barré syndrome. And lab studies suggest there might be other neural complications in adults, too.
It seems that the virus is attracted to nerve tissue or brain tissue. And so we worry that in humans, that this virus may destroy nerve tissue or attack brain cells.
March 7th. March 7th, they're asking for specific information about how the money would be spent.
Yeah.
And the Speaker's office has helpfully mailed them to us during the briefing.
Yeah. They said,
Good.
here are the letters, Josh.
Yeah, that's great.
I guess, but if there were requests,
somebody on my staff maybe should send them. Maybe they missed the memo. Maybe they were sick on February 22nd.
Specific information about how the money would be spent.
I guess I find it hard to believe. We will provide this letter to all of you, just so that you all can consider it. Maybe you can answer the questions for them. I don't know if it means that they haven't looked at the specific proposal, but this is not like a fact sheet. This isn't just like a specific chart with some numbers. This actually includes a detailed analysis of exactly how the money would be spent. And again, this includes legislative language that for 2 months now, Congress has refused to act on. And you heard from our public health professionals who stood up here and said that this is what they need to fight Zika. This is what they need to fight Zika. I think what is more likely happening is that we are seeing Republicans change their explanation for their inaction. They are grasping in the dark for an excuse. Several weeks ago, you heard Speaker Ryan say, quote, "There's plenty of money in the pipeline right now that can go to Zika." That was the explanation from Speaker Ryan a few weeks ago. Earlier this week, Speaker Ryan said that funding for Zika should go through the normal process. Considering that today is the deadline for the House to pass a budget and they're not going to meet that deadline, I'm not sure that pursuing the normal process for an emergency like this, given Congress's inept ability to handle the budget, is a particularly good idea. So that's why I think it's a little curious, after weeks of saying there's plenty of money in the pipeline or there's plenty of time for us to act, that Republicans are now somehow saying that they don't have enough information. I don't think that really passes the smell test.
And given the fact that it's obviously getting warmer by the day, are you confident that this fight is going to get the funding that it needs?
Well, it will, our success to do, well, let me say it this way. Our public health professionals stood at this podium on Monday, seems like a while ago. They stood at this podium on Monday, and they said that they don't have what they need right now, that they're not doing everything that we should be doing right now to protect the American people from the Zika virus. There's a lot that can be done. It required reprogramming funds from other core priorities. It required trying to extract loose change from the proverbial couch. But there's important work that's being done at the National Institutes of Health and the Centers for Disease Control to try to fight this disease and to try to fight the virus and to try to protect the American people. But we're not doing everything that we should be doing. We're certainly not doing everything that we could be doing if Congress would fulfill its basic responsibility to ensure that these public health professionals have the resources that they need to protect the American people.